pills, pills, and more pills. Over-the-counter medication or through a prescription, the pharmaceuticals is a multi-billion-dollar industry here in the United States. Our senior citizens fill an average of 9 to 13 prescriptions a year, while those in the nursing homes may take as many as 9 pills a day. Why so many? What are the costs? With the cost of medications rising yearly and the average senior on a fixed income, and with cuts to Medicare, seniors are paying more than ever before. Sometimes they even have to choose between taking their medicine or paying bills. Today, on the Caregiving Doctor Show, we will talk with a pharmacist about the cost to senior citizens and the importance of taking medications as directed. Prescription medication and the elderly. What you need to know. That's today on the Caregiving Doctor Show. Hello, everyone, and welcome to the Caregiving Doctor Show. I'm your host, Dr. Clarissa Fell-Smith, and joining me today is Dr. Patrick Devereaux. We are talking about medications. He is a pharmacist right here in Birmingham, Alabama. Thank you for joining me today.
My pleasure. Thanks for having me.
Well, why did you go into the field of pharmacy in the first place?
I started working in a drugstore when I was 16. I loved the patient connection and talking to people and getting to know them, talking to them about their health, and so I pursued pharmacy as a career. I actually grew up in Florida. That's what brought me to Birmingham, went to school, and have stayed here ever since.
So the word pharmacy means?
Well, what we're trying to do in pharmacy is treat certain conditions, certain disease states with different chemical combinations, different medicines. All of these medicines work in the body in different ways. They target different areas of the body. They target different things that control blood pressure, target things that control blood sugar. So pharmacy is the study of how all of those medicines interact with those receptors and also interact with each other inside the body in the normal physiologic process.
Do you have any stats for us today about drug overdoses and drug addictions? You know, America's addicted to medication,
right.
Prescription drugs.
Right.
Talk a little bit about that.
The number of patients who are addicted to some form of prescription medication is over 8 to 10 million.
Whoa.
Right, and that doesn't necessarily mean what you would normally think of as addicted to medications like pain prescriptions and things like that. These are medications that sometimes are viewed as harmless, but they're not harmless if they're used the wrong way. And so, for example, someone who is in pain, who is utilizing a pain medication the correct way for pain, doesn't really get addicted to that prescription. But if they start using it outside of the need for pain, that's where it starts to become a problem. So when you factor all of those things in, usually drug use, drug abuse, and addiction starts off as a normal therapy for a certain condition. Pain management or something like that. But then when that therapy is over, that addiction may still linger. And the challenging part there is stopping the medicine when the symptoms go away. And that will avoid the abuse and addiction problem that we have.
Today we're primarily talking about aging adults, older adults. Sometimes they don't like to be called seniors. And we're talking about caregivers, those of us who are caring for mom and dad. When you talk about addiction, does it apply also generically to that aging population as well?
It does. We see a lot, especially with medications for sleep. As our bodies get older, we have a hard time sleeping, and I know caregivers are aware of that, acutely aware of that especially. And so right now we do see some certain medications used for sleep that are not that not wise to use in the elderly because of the risk for falls and things like that. So we're especially concerned, and there is definitely a risk for addiction with certain medications related to sleep and anxiety especially.
Let's talk a little bit about how medications work in the body. I know a lot of medicines cause side effects, depending on what it is, but how do they really work in the body?
So when we take a medication, we swallow it down, it goes into our stomach, and then at that point is metabolized and sent to the different parts of the body in through our bloodstream. It knows where to go because it knows where to target certain receptors. So all medicines have a certain chemical structure, and those structures match up with the receptors in the body. And so those medications will go and target those receptors in that specific area.
So since we're talking to caregivers, what do you think the number one problem is for those of us who are taking care of mom and dad? Would it be giving the medication at the right time? Would it be giving them too much medication? Are we not doing a good job with that for the most part, or can we do better?
We can do better. And to answer your question, I think it's all of the above.
What do you mean?
Well, sometimes it can be very easy to be overwhelmed when taking care of a loved one. Very, very easy. In fact, caregivers especially can be really overwhelmed with having to manage multiple medications and trying to keep up with multiple bottles and setting those things up. And so a lot of times we see sometimes accidentally giving too much medication, or accidentally maybe omitting or keep leaving out a certain medication they need for their blood pressure or their diabetes or something like that. So those are some of the problems that we see. And sometimes they accidentally will give too much medicine, or may be confused about which medicine is supposed to be stopped. Let's talk, for example, when they go to the hospital. They come out of the hospital, they make a lot of changes. Most time when they go into the hospital, they make a lot of changes. They come out of the hospital, and the caregiver may not have a great understanding about which medications are supposed to be stopped now that we're out of the hospital. Maybe they put them on new medications that are replacing older medications. What we've seen happen before is if the patient or the caregiver doesn't have their medications reconciled when they discharge from the hospital, and reconcile just means comparing their old medicines to their new medicines by a nurse or a physician in the hospital, then they may continue taking their old medicines with their new medicines, and that could be too much. And the caregiver just may not have understood that, so they're unintentionally sometimes giving too much medicine. And that's something typical that we would see, and that really just comes from an overwhelming amount of information that patients and caregivers, especially when it comes to medications, have to keep up with.
What about the role of the physician? I mean, the physician, the communication between the caregiver, the aging adult, and the physician, or if they're changing doctors.
Right.
And it's just like with my mom almost OD'd on, overdosed on prescription medicine, and I called her just in time. You know, the ER doctor said, "Hey, you would have lost her if it had been, you had waited another day."
Wow.
So that's why we're having this show, is that I've had personal experiences with medication,
Sure.
or a parent who says, I can't remember when I took my medicine,
Right.
or they have memory problems or
Right.
dementia.
Right.
So when you're looking at all those various issues with caregivers, can you just talk about what are some things that caregivers can do right now?
I'm going to
to
say the
ensure
first
better
and foremost
accuracy?
thing is please try to get to, and I know this is tough to do with a lot of people working, but please try to get to as many doctor's visits as you can with that loved one that you're taking care of. Okay. Ask the questions, bring something to write on, and try to if you go into the visits with specific questions.
With the medicines too.
With the medicines. Try to absolutely bring your medicines to every office visit, or at least a comprehensive list, an up-to-date list of all of the medications that you're taking. Because sometimes if you have a specialist or another doctor that may have started a certain medicine and you're at one doctor's office, they may not know that, oh, well, she's already on a medication that does this. So taking notes, asking questions, and making sure you have the most up-to-date information possible when attending those visits. That's the most important advice I have.
Dr. Devereaux, tell me, what do you have here? What is this?
This is called Medicine on Time, and this is a package system that we had made an investment in to help patients and caregivers manage their medications effectively. So what you have here is a model of a patient's medications, and this patient's medications are grouped together by day for the entire month. So this is the morning medications this patient takes for the entire month, and it's listed by date. All of these squares have the meds prepackaged in them that we've packaged, that we've put together for the patient and the caregiver. So then all they have to do is tear this out every morning, and the medicines that they need to take that morning are already packaged in there. So it's peace of mind for the patient and the caregiver. You know, did I remember to take all of my medicine?
Bottles, and then I take the top off one.
Right. And you have to admit sometimes it's a little scary when you think, well, did I maybe accidentally do two
Right.
pills instead of one? This takes a lot of the worry out because we do this for you. We have it all sealed and ready to go. The patient comes in once a month, picks up all of the medications prepackaged like this. So it really has that peace of mind component, as well as making sure the patient's taking the medication correctly on a daily basis, which we all know will lead to fewer hospitalizations,
Well, which we have
fewer
some studies on the
complications.
use of this, some studies,
Yeah.
that reveals the efficacy and the effects of it, outcome-wise.
Well,
or does it increase accuracy?
Well, we don't have specific studies about the packaging. However, we do know that adherence to medications can decrease hospitalizations and readmissions by 50 to 75%. Just proper adherence to medications, proper understanding of medications, and taking them on a consistent schedule.
All right, we'll be back more on the Caregiving Doctor with Dr. Devereaux. Passionate, loving, caring, nurturing. Looking for quality child care for your little one? Caregiving Kids Academy believes that precious little ones should have the best care. From 6 weeks, pre-K to after-school care, we're with them every step of the way. Now enrolling. Caregiving Kids Academy.
Little leaders, big hearts.
A modern retirement plan is needed now more than ever. Consider the new Safer, Smarter Reverse Mortgage as a way to supplement income and gain financial security. Call Alabama's reverse mortgage guy, Scott Underwood, with iReverse Home Loans with your questions or to request free information. Scott has seen hundreds of reverse mortgages to completion in the last decade while working with each person to ensure their understanding of this safe financial tool. Call Scott at 908-2993.
It is my life's work, caregiving. I've worked for over 30 years as an occupational therapist. I'm a radio show talk show host, book author, and national columnist. Now I'm bringing you other caregiving experts to help you care for yourself. Because remember, I am caring for you and your loved ones too. More coming up on the Caregiving Doctor Show. Welcome back to the Caregiving Doctor Show. I'm sitting here with Dr. Patrick Devereaux. He's a pharmacist, and we're talking about you and your medications as a caregiver and an aging adult. During the pre-conference or during the break, we were talking about medications and some of the side effects of medications today. And what are some of the most common errors that people are making?
The most common errors that I think we see people making is taking two of the same type of medication unintentionally, and then that kind of goes back to that communication piece that we're talking about.
An example of that.
So they may go to the hospital and they may get a prescription for an antibiotic, okay, and they get discharged and they may have another drug on their profile that interacts with that antibiotic. Okay, it's rare, but it does happen. And if the physician's not aware of it, and the pharmacist is not aware of it, that interaction may not be caught, and that could lead to a major problem down the road, or while they're taking that medication. So all that to say that communication and having an up-to-date medication list is the key. I know it doesn't really sound like an error, but one of the most common errors we see is something like that, which is called an error of omission, meaning we're accidentally omitting some information, and the pharmacist and physician who are acting in the best course of care may not have all of the information possible to make a decision about treating that patient without an interaction with their other medication.
How important is it to take it as directed? Like some medications with food, without food. I mean, it gets confusing to me. I mean, is it just me?
No,
Okay.
it is, and it's always good to ask questions. If the directions are hard to understand, hopefully everyone's going to a great pharmacy where they're going over the medications with them before they leave the pharmacy, which is something we pride ourselves in doing. And part of that is verbally talking about the directions. Verbally, we go through the directions with the patient to make sure they understand what does one tablet every 4 to 6 hours mean, or what does one tablet twice a day mean. Does that mean I could take one tablet now and one tablet maybe 4 hours later, or do I need to space it out? We answer those questions. We want to make sure that that's understood. But if for some reason you're not getting that information, it's always good to ask the question. When you get directions on a bottle for a caregiver or for a loved one, always call the pharmacy back if you're not sure what those directions really mean, as sometimes they can be confusing.
Now let's talk about the use of medication with other herbs.
Okay.
Okay, like for example, garlic.
Sure.
And my mom likes to take all kind of stuff. And mixing it with medication, even alcohol. Talk about that.
I'm going to recommend anytime that we start an herbal supplement that you consult your pharmacist to make sure there's no drug interactions. So make sure you're talking with the pharmacist that has a list of all of your medications. One of the most common, there's a few herbs that interact with everything, and then most herbs really don't have too many drug interactions. Some do, but there's a few really bad bad interactions out there with some herbals. Overall, herbals can be safe, but I always recommend to consult your physician and pharmacist, especially before starting them, especially if you're on a medication for blood clots, blood thinning. Those are the most common interactions that we see. We don't want to accidentally have that blood thinning aspect working overtime because of an herbal supplement.
Now, how important is it to take it at the same time? For example, if my mom's medicine is at AM and PM, should I take it at 10 o'clock every morning at the same time?
Yes.
How important? What?
Yes.
It says morning. It says AM.
Right.
It doesn't give a time specifically.
Right.
So you're saying
it will work the best if we can keep the times consistent. So let's talk about why. When you have a medication that you take twice a day or 3 times a day or once a day, the reason why you take it there instead of just taking everything once a day is that all medications have different half-lives in the body. What that means is certain medications are in and out of the body quicker than others. So for antibiotics, certain antibiotics that you have to take twice a day, if you don't take it twice a day, you have a period where there's no medication in your system because of that half-life. So all that to say that if you can keep the times consistent, that minimizes the risk of any hours going by where there's no medication in the system. So if a drug is designed to be given every 24 hours, we want to minimize any possible period of time where there's no medication in the bloodstream. So we want the concentrations of the drug inside the bloodstream to stay as consistent as possible. So if you take it, at 8 o'clock one day, and you may not remember to take it till 2 o'clock or 3 o'clock that day, there's a possibility that the medication may not be as effective because the levels of the medications have dwindled down during that short time period.
So when you're talking about medications in general, insurance, let's talk a little bit about insurance.
Okay. Yeah.
Because that's a big one.
Yes, it is.
And these pills cost a lot of money.
They do.
Some people have to choose between taking a pill and paying the bill.
We see it every day.
You see it every day?
Every day. Every day. And what the trick is asking the questions at the pharmacy counter. Okay? Is there a less expensive alternative to this? Is there something that works the same way that my insurance will cover at a different level?
That's the physician though, isn't it?
It is, but sometimes the question starts at the pharmacy because the physicians are very well versed in the medications, but sometimes they may not realize, well, there's a generic of a medication on the market that's similar to this. They may know that drug exists, but they may not realize, well, this is already generic, or the cost has come down on this, or something like that. Where it also gets tricky is with insurance plans. Certain insurance plans have something called tiers, and tiers are the more expensive medications are higher tier copays, meaning you have more cost sharing involved when you have these expensive drugs. And then certain drugs, the less expensive medications, generics for example, are at lower tiers, and so the costs are usually lower for patients on insurance for generic drugs. So if your costs are high, and sometimes there's no way to avoid high costs, ask questions. Ask the questions, is there an alternative? And it may be asking the doctor. The doctor may not want to change your medicine, but it's good to know what the options are out there. If you're having a hard time affording your medication, it's maybe a good idea to take a look between your pharmacist, physician, and your insurance plan to see if there's a lower cost alternative. Medications are not going to work if you can't afford them. If you can't afford them, you can't take them. Medications don't work in people who can't take them.
And a lot of older people don't want to take them in the first place.
Right.
They don't want to say, I don't want to take all those pills. I got too many pills. 8 or 9 pills. What's the average number of pills?
Yeah, that's 8 or 9 sounds about right. Yeah, per time of day, at least for what we've seen in our practice.
So Medicare doesn't pay, I'm jumping a different subject here. Medicare doesn't pay for, if you talk about medications and equipment, we talked a little bit about that at the pre-conference, about equipment. In addition to your medicines, the person may need equipment from the pharmacy.
Right.
Is that usually paid for?
It depends. Medicare can be a little challenging. It used to be a lot different. And then what happened over time is that a lot of medical suppliers started committing high amounts of fraud. And so now for that reason, it's very tough sometimes to get equipment paid for by Medicare. Medicare does cover that equipment, but sometimes you have to go to a certain what they call a competitive bid supplier, someone that puts a bid in with Medicare and says, I'll supply it at this price. I mean, they say it's quality, but it really has more to do with cost.
Like what they'll pay for a walker?
Right, walker,
Wheelchair,
a walker, wheelchair. Those are good
cane.
examples of what things we used to be able to build those, and then they went to the competitive bidding program. So now there's only one supplier in this area of town, actually this area of the county, that is able to build those. Even though there's other medical suppliers and we can supply other medical equipment such as diabetic shoes, diabetic testing supplies, those are okay. But certain items went to
all
that
those
competitive
braces,
bidding
all
program.
those knee braces, and
We
walking
can build
braces.
those, yeah. We can build those. We can build canes. But once you get into walkers, bedside commodes, things like that, the billing for that becomes a little bit challenging.
And tub benches. I don't think they pay for tub benches. Shower
Unfortunately,
chairs.
right. Unfortunately, Medicare does not pay for anything inside the bathroom, which, my personal opinion is that I think they should pay for anything that minimizes a fall risk or minimizes a hospitalization, which is a lot of what they do pay for is intended to prevent a hospitalization or prevent a complication. So if you give somebody a cane and they pay for that, then the intention is that they will, not have a fall. If you pay for a pair of diabetic shoes, the intention there is that the circulation of the feet will improve and they'll have less likely to have a toe amputated or something like that, leading to additional medical costs.
Great information.
Thank you.
We'll be back in a minute on the Caregiving Doctor Show. Passionate, loving, caring, nurturing. Looking for quality child care for your little one? Caregiving Kids Academy believes that precious little ones should have the best care. From 6 weeks, pre-K to after-school care, we're with them every step of the way. Now enrolling. Caregiving Kids Academy.
Little leaders, big hearts.
A modern retirement plan is needed now more than ever. Consider the new Safer, Smarter Reverse Mortgage as a way to supplement income and gain financial security. Call Alabama's reverse mortgage guy, Scott Underwood, with iReverse Home Loans with your questions or to request free information. Scott has seen hundreds of reverse mortgages to completion in the last decade while working with each person to ensure their understanding of this safe financial tool. Call Scott at 908-2993.
If you have a topic you'd like to explore, please visit our website at thecaregivingdoctor.com or visit our Facebook page. Did you know that the Caregiving Doctor is available for speaking engagements, workshops, or seminars? Contact Dr. Clarissa Fell-Smith at 205-201-4096 for your next event, serving businesses, churches, and organizations. More coming up on the Caregiving Doctor Show. Welcome back to the Caregiving Doctor Show. I'm here with Dr. Patrick Devereaux, and we are talking about pharmacy and medications. Great information today. Now we're going to summarize and wrap up. What are the most important things that caregivers and older adults need to know about taking their medicines?
The most important thing that everyone needs to know, both adults that manage their own medicines and caregivers that manage the medicines for them, is understanding where the medications play into their overall health plan. What I mean by that is, if I'm taking a medication for blood sugar, what is the long-term reason for using that medication? And once we put it in that perspective, it becomes a little bit easier to manage multiple medications. Right now, the average person takes a pill and they're like, I just got another pill I need to take. But they may not realize that taking that little peach pill is preventing them from going on kidney dialysis. It may be preventing them from losing a limb due to diabetes. And sometimes putting it in that perspective is very important. So ask questions at the doctor, at the pharmacy, try to get some perspective as to what these medications are doing, how is it going to affect my quality of life. We look at it as we're dispensing medications for people, but really what we're trying to do is improve health outcomes, to reduce hospitalizations, to improve quality of life, and to let everyone live healthy, active lives because they're well managed on medications that are keeping them healthy.
Well, thank you for being here today on the Caregiving Doctor Show.
My pleasure.
Will you come back again?
I would love that, yes.
And also, his information will be posted at the end of the show. You can contact him. As a matter of fact, can they call you?
They can call me anytime, 424-3194. We're here in Bessemer, located right on 13th Avenue North. We're here Monday through Friday, 9 to 6, Saturday, 9 to 1. And I'm always nearby. Even when I'm off, my staff knows how to reach me. I'll be happy to answer any questions that you have.
All right, and you can find me on Facebook, other social medias, or at thecaregivingdoctor.com. Hey, don't forget that I'm caring for you and your loved ones too. See you next week.
Today's show is brought to you by Caregiving Kids Academy, Little Leaders, Big Hearts. Scott Underwood, the Reverse Mortgage Guy, and Alabama Reverse Mortgage. Sandra's Designer Closet. And Lewis Harper Jr. and the Harper Insurance Agency. Join us next week for another informative Caregiving Doctor Show.